When most people think about skeletal muscle, they think about movement, posture, or physical strength. Those functions are important, but they are incomplete. From a clinical perspective, skeletal muscle is understood best as an organ system. In fact, it is the largest organ system in the human body by mass. Like any organ system, it has metabolic, endocrine, and structural responsibilities that extend far beyond motion. Muscle tissue actively communicates with other organs. It stores and releases energy. It influences insulin sensitivity, inflammatory signaling, and mechanical stability. When muscle mass and function decline, the effects are not isolated to physical performance. They show up in laboratory values, injury risk, recovery time, and long-term disease trajectories. A helpful way to think about muscle is as a biological savings account. Early and midlife deposits through strength, nourishment, and recovery create reserve. That reserve supports metabolic flexibility, protects joints and bones, and provides resilience during periods of illness, stress, or aging. This is not about aesthetics or athletic identity. It is about preserving a system that quietly supports nearly every other system in the body. To understand why muscle preservation is a clinical priority, we need to look at what muscle actually does. After a meal, circulating glucose must be cleared from the bloodstream, and approximately 70 to 80% of that glucose is taken up by skeletal muscle. Muscle tissue expresses glucose transporters that respond to insulin and to contraction itself. This means muscle can remove glucose from the bloodstream both when insulin signaling is optimal and when it is impaired. As muscle mass decreases, the body loses its primary site for glucose disposal. This increases post-meal blood sugar exposure, raises insulin demand, and contributes to insulin resistance. This mechanism is relevant whether someone is 25 or 65, pregnant, postpartum, or entering menopause. Preserving muscle is one of the most effective non-pharmacological strategies for stabilizing glycemic control across the lifespan. Muscle is metabolically expensive tissue. Even at rest, it requires energy to maintain cellular structure, ion gradients, and protein turnover. Basal metabolic rate is influenced by many factors, but lean mass is a primary contributor. As muscle mass declines, resting energy expenditure declines with it. This shift does not reflect a lack of discipline or effort. It reflects physiology. Maintaining muscle helps preserve metabolic rate, which in turn supports energy regulation, weight stability, and nutrient partitioning. This is particularly important during life stages marked by hormonal changes, stress, or reduced recovery capacity. Muscle also plays a critical mechanical role. When muscle contracts eccentrically and concentrically, it absorbs force. This reduces the load transmitted directly to bone, cartilage, and connective tissue. Strong, well-coordinated muscle acts as a shock absorber for joints and as a dynamic protection for the skeleton. Loss of muscle strength and coordination increases joint stress, accelerates degenerative changes, and raises fall and fracture risk. This is not an inevitable consequence of aging. It is a modifiable risk factor. Preserving muscle requires more than isolated exercise sessions. It requires a framework that respects physiology, recovery, and consistency. After age 40, the rate of lean mass loss accelerates unless actively addressed. This process, known as sarcopenia, begins earlier than many people realize. Strength training provides a mechanical signal that tells the body muscle tissue is still required. The goal is not maximal load. The goal is sufficient stimulus to maintain fiber size, neural recruitment, and bone signaling. For most adults, this means progressive resistance applied consistently with attention to form and joint tolerance. Muscle adaptation occurs during recovery, not during exertion. Micronutrients such as magnesium, zinc, vitamin D, and adequate protein intake support tissue repair, neuromuscular signaling, and connective tissue health. Inadequate recovery shifts the system toward inflammation and injury rather than adaptation. Recovery also includes sleep quality, hydration, and spacing training sessions appropriately. These factors are often underestimated, particularly in caregiving and transitional life stages. Daily rhythm matters. Morning routines that include light exposure, gentle movement, and consistent nourishment stabilize circadian signaling. This stability influences cortisol patterns, insulin sensitivity, and perceived energy throughout the day. For many people, anchoring strength or mobility work earlier in the day improves adherence and reduces glycemic variability. This is not a requirement, but it is a useful clinical lever. Consistency protects against injury and burnout. Tempo training, which is controlled movement speed with intentional pauses, allows lower loads to produce sufficient stimulus while reducing joint stress. This approach supports a minimum effective dose strategy. Small, repeatable sessions performed consistently outperform sporadic, high-intensity efforts. This is especially relevant for individuals balancing work, caregiving, or recovery from injury. Muscle preservation is a clinical necessity. It supports glucose regulation, metabolic stability, joint integrity, and long-term independence. The goal is not perfection or intensity. The goal is preservation through informed, sustainable action. A practical starting point is establishing a structural baseline by understanding your current strength, mobility, and movement patterns. If you would like a clinically grounded place to begin, download the Strength and Mobility Guide. It outlines simple assessments and foundational movements to support long-term musculoskeletal health. Use the information as data. Apply what fits your current season of life. Muscle is not about doing more. It is about maintaining what supports everything else.